high-dose chemotherapy followed by autologous stem cell transplant and consolidation chemotherapy are post-remission strategy options for ELN 2022 favorable and intermediate risk patients in an MRD-negative complete remission. In our analysis, we compared these two modalities and we focused on favorable and intermediate risk patients that were intensively treated. For this purpose, we pulled data from two recent HOVON-SAKK-Nordic clinical trials. The auto group consisted of patients that received busulfan and cyclophosphamide, followed by autologous stem cell transplant, and the chemo group consisted of patients that received mitoxantrone and etoposide as consolidation. In total, 224 patients were consolidated with auto and 199 with consolidation chemotherapy. Relapse-free survival, overall survival, cumulative incidence of relapse and non-relapse mortality were similar between the two groups. With regards to the adverse events, grade 3 to 5 oral mucositis was more common in the auto group, and grade 3 to 5 pneumonia was more common in the chemo group. Moreover, days until count recovery and days of hospitalization were longer in the chemo group. Focusing on MRD-negative patients in the favorable risk group, RFS and OS were similar, and this was also true for the intermediate MRD-negative patients, so I guess no difference in RFS and OS between the two modalities. In further subgroup analysis, patients that got a late complete remission after induction, so the patients that got to CR after cycle 2 of induction, and those that had elevated white blood cell count at diagnosis, had a better relapse-free survival with autologous stem cell transplant, but this did not translate into a better OS. Overall, chemotherapy appears to be the preferred option since it allows for the addition of novel targeted agents.